Hello, everybody. Christina Previtt here. Welcome to the PT on Ice Daily Show. We are at Wednesday. I know sometimes it is difficult to know what day of the week it is, which means that it is our Jerry on Ice segment. I'm one of the lead faculty for Modern Management of the Older Adult Essential Foundations and Advanced Concepts with Dustin Jones. If you guys are looking into any of our course offerings, most of our courses right now are online. We are rescheduling all of our live courses for Modern Management of the Older Adult up until the end of April. And so we'll keep you guys posted if you are enrolled in any of our online courses, our live courses, and we've rescheduled them. We've already reached out to people who have signed up. So just so you guys know, if it is being rescheduled, you guys will hear about it. For our online course, we have our Essential Foundations course and Advanced Concepts. We originally weren't going to be running another cohort of Advanced Concepts until September, but given the fact that there are many people who are looking for CEU requirements and they were relying on live courses, we've opened up that course. So the next round of the online version of Essential Foundations is going to be starting May 13th. And Advanced Concepts will start a week later, May 20th. The only thing is if you are interested in taking Advanced Concepts, you have to have taken the online version of Essential Foundations because we go into a lot around geriatric exercise prescription, and then we apply that in more clinically complex populations in our follow-up course. Okay. Over the last couple of days, we have had the release of a clinical practice guideline for physical therapists who are working in the acute care setting in light of the ever-evolving situation with COVID-19. If you guys have been following the news, you know that we are at the very beginning of a rough couple of weeks in regards to the burden that is being placed on our healthcare system. And so this guideline was very timely, and I am going to say that I am extremely impressed with this cohort of individuals who has taken the time to try and synthesize the information that we know and try and give physical therapists some direct guidance as to what we should be doing as acute care PTs working with individuals who could have potentially been exposed to COVID, who are positively exposed to COVID, or who are recovering from COVID. And so this guideline was made by the World Confederation for Physical Therapists, the International Confederation of Cardiorespiratory Physical Therapists, the Australian Physiotherapy Association, the Canadian Physiotherapy Association, and several other groups. So you're going to see me kind of flipping back and forth because I want to make sure that I'm giving you guys a synthesis of the information that has been published in these guidelines. It's actually also going to be linked in this week's Hump Day Hustling. So if you guys want to take a look at the full guideline, it is very succinct, then I encourage you guys to do so. The first thing that this guideline goes through is some information that we know in regards to transmission and the presentation of COVID-19. We know, obviously, that it is highly, highly contagious and that most people are transmitting this virus when they are completely asymptomatic. That has created a lot of ethical concern for physical therapists who are working with vulnerable sector because it could potentially be 5 or 6 days before a person becomes symptomatic, and that transmission could have then affected a person's full caseload, where especially when I shouldn't say especially with vulnerable populations, but especially the impact that COVID-19 can have on an older adult population, it has definitely created a lot of conversation about what is considered essential and not, and if PT should be working or not. And so if you guys have any of those conversations, I encourage you guys to let us know because it's been an ongoing development for sure. In regards to presentation, they are saying that about 80% of cases are asymptomatic or mild. So the fact that you could be completely asymptomatic and be a carrier of COVID-19 is slightly frightening in regards to how we're going to stop this spread and why physical distancing is so important. In regards to its presentation, some people will say, well, I had a fever, but I didn't have a cough. So I think I just had the flu and I didn't have COVID-19. The presentation of COVID-19 is not always the same for each individual. And we know that based on the severity of different symptoms, depending on a person's comorbidities, background, and age. Fever is the predominant symptom of COVID-19, with 89% of individuals developing a fever. 68% of individuals develop a dry cough. 38% of individuals develop fatigue, an overwhelming sense of fatigue. Sputum production is present in 34%, and shortness of breath is present in 19%. So using shortness of breath as the differentiating factor between if an individual could be suspected positive for COVID-19 may not be the most appropriate. It may be the trigger for hospitalization or going to seek medical care versus staying at home and self-isolating. But if you are still working with patients and they're developing a fever over 104, then that is going to be possibly a confirmed positive, just because of the nature of our healthcare system and some of the limitations with testing. So it's thought that 15% of cases are severe that are infection requiring oxygen, and 5% are critical requiring ventilation and life support. Okay, going into some of the preliminary reports. So they said chest radiographs could be diagnostically limiting with COVID-19. So we're not going to get a ton of information about if an individual is positive or not based on chest x-ray. They need to be aware that the lung CT can have some discrepancies on it that may be indicative. Lung ultrasound can also potentially be used at the bedside to try and see if there's any sort of consolidation in the lungs. But what this is really saying is that in terms of further testing, other than obviously doing a COVID test, we don't really know the presentation, and it seems to be fairly broad in regards to how COVID-19 is presenting at the bedside. And so as more information comes out, this guideline is going to be updated if there are any different differentiating factors that can really help with our treatment and care pathways. And so now I'm going to go into what it is saying in regards to the acute care side of things. The first thing that it is saying is that we need to be prepared to have all hands on deck. We know that the next 2 to 4 weeks are going to be absolutely critical, and the number of cases is skyrocketing, which means that we're going to have an increased demand on our healthcare system and potentially an increased demand for the need for PT on frontline. So the guideline is saying that if possible, allow for additional shifts for individuals who are part-timers, offer the ability to electively cancel any leaves that were scheduled, try and plan a pool of casual staff, try and recruit individuals from different sectors like academia who have experience in working in acute care, and other individuals who are working in non-clinical roles, and try and bring them in. I know the College of Physiotherapists of Ontario, where I am, sent out an email recruiting community-based PTs in case they need it for being placed on the front line for individuals in response to the COVID-19 pandemic. The next thing that they say is that if you have no experience in ICU, placing yourself in ICU is probably not going to be the most beneficial thing, which I think is a really important, like I know as PTs, especially I can feel this myself, you just want to help. But if you haven't been around lines and tubes and intubation and all these different chest physiotherapy modalities, sometimes you can be more of a harm than a help when you are in the front line. And so there are other ways that we as PTs can help. And what they're thinking about is that we need physical therapists who actually have the specialized knowledge, skills, and ability to work in ICU and, for example, be able to contribute with some of those modalities. So they're looking for different advanced staff. If we don't have that option of individuals, they are recommending that PTs before going into the front line are making sure that they have taken control of their own learning and done the appropriate amount of training so that they can be on the front line and be beneficial and helpful with the flow through the floor. And so things like making sure you have appropriate PPE training, making sure that you have the appropriate courses or that you've brushed up on some of your cardiorespiratory techniques are going to be extremely important. And then the last thing that this guideline talks about in regards to staffing is just how important communication is. And the whole staff needs to be informed of changes to protocol. It is extremely challenging right now because protocol seems to be changing every hour, if not every half hour, but it is extremely important, especially if you are in a leadership role, to make sure that you are communicating with your frontline staff so that they are aware of what is going on and what the new protocols are. Sorry, the last thing, and we talked about COVID-19 and pregnancy on the ICE stave off, that's my business, the ICE Facebook page, is that we are, right now it is currently recommended that if you are pregnant, that you should probably not be entering into an area with COVID-19 isolation rooms or cases because you are slightly immunosuppressed. Right now, we don't think that the transmission is worse for individuals who are pregnant. We don't think that it transfers into the breast milk for moms who are breastfeeding. We also don't think that it transfers from mom to baby if you are infected. But right now, we just don't know enough information. And we do know that women can be slightly more susceptible to getting ill when they're pregnant just because of that slight immunosuppression. So it is important there to try and avoid exposure. And I know that there's a lot of women in healthcare right now who are still in front lines. And I know that stress and anxiety is really overwhelming. Okay, now who should we be treating? If we are in acute care, where is our role? So in regards to chest physical therapy, as I said with the percentages, only 34% of individuals who are presenting with positive COVID-19 are experiencing sputum production. A dry cough is not an indication for chest physical therapy, and therefore a physical therapist should not be entering into the room of a person with COVID-19 who does not have an indication for referral to PT. And so in those cases, physical therapy intervention is not indicated. They are trying to limit the amount of individuals who are going into isolation rooms in order to try and prevent the spread in the community, prevent spread to healthcare workers. And so we have to make sure that we are doing the appropriate screening. They have suggested that screening, so where we are indicated is if there is issues with airway clearance, so if we are doing any sort of suctioning, if we can do things like changes to positioning, percussions, any sort of our cardiorespiratory toolbox, things for individuals with sputum production, then we are indicated for going in for care. And then the third area is around mobilization and exercise. And the idea around that is trying to prevent anything like ICU acquired weakness, any individual with frailty and multiple comorbidities that is already at the cusp of losing their independence, who may be more likely to have that significant decline in physical function that they're not going to be able to recover from, then that referral to PT is likely going to be necessary in regards to trying to at least mitigate the loss in muscular strength so that individuals can return to functional ADLs. And so the idea around screening for that is that they're now trying to think, how can we screen an individual without actually having contact with them? And I think there's a lot of discussion around how we can utilize technology to see if that referral is appropriate without actually, again, having another exposure or contact with an individual who is positive for COVID-19. And so they're thinking about doing things like telephone screening or conducting a subjective assessment from a significant distance so that, again, you're kind of out of that splash zone where that 2 meter distance where you could be you could be exposed to any sort of droplet. From the PPE perspective, that is always the question. They have made recommendations. They have said in general that at a minimum, if you have a suspected or positive case of COVID-19, that you should be on droplet precautions at a minimum. So that is a surgical mask, face shield, gown, gloves. They say ideally, especially if you know that a person is positive, then you should be on airborne precautions, which means N95 mask, face shield, gown, and gloves, ideally single use. right now, we know that with the horrible shortage of PPE that we are seeing these protocols not necessarily being held to 100% standard, which is so challenging because we are trying to keep our healthcare providers safe. We now know that a significant portion of some of our positive tests in many cities are healthcare workers who have been in contact with individuals who are in the hospital system. And so we need to make sure that we're trying to keep our health providers safe. But if we don't have PPE, how are we going to do that? So yes, droplet precautions are a minimum: surgical mask, face shield, gown, gloves, and airborne precautions with a positive case, which includes an N95, which is fitted, and making sure that you have had that fitting done in a reasonable amount of time, since the COVID pandemic is going to be important, because if you've had any change in weight of plus or minus 10 pounds, the fit of the N95 may not be as snug as it needs to be in order to avoid potential exposure. All right, in regards to so that's kind of in the acute care. I think one of the other ways that we're going to see the increased need for PT is on the other side of this pandemic. And so as you start to get individuals who have recovered from this condition, from COVID-19, who are now respiratory compromised, who are potentially experiencing some ICU acquired weakness, who are trying to slowly wean off ventilators, how can we help? And so what they have talked about is around how the referral to PT is going to be really important in regards to mobilization and exercise prescription in order to get individuals into the home, and what we can do about that. So the guideline is saying that the mobilization and exercise prescription should involve careful consideration of the patient's state. So making sure that clinical presentation is stable in regards to respiratory and hemodynamic function. We want to make sure that the exercise equipment that we are using can be safely cleaned, disinfected. We should be considering using things like TheraBands that can be single patient use, rather than having equipment that needs to be wiped down, which could increase the risk of transmission. Larger equipment, things like mobility aids, ergometers, chairs, and tilt tables, must be able to be easily decontaminated. And we're going to try and avoid the use of specialized equipment unless necessary for basic function. So those are some of the recommendations for when individuals are in hospital, and then trying to help with discharge planning in order to try and get an individual back to their home. So that's just some of the guideline for acute care. I hope you guys find that helpful. The guidelines are going to be changing constantly as we start to get to know more and more information. The guideline recognizes that we don't have, the highest level of evidence that is comparing transmission rates and what we know about long-term outcomes for individuals with COVID-19. We just don't know those things yet. But I think this gave a really good breakdown of where PT is appropriate, and just as importantly, where PT is not appropriate, where we don't want to have another healthcare provider that could be exposed, and why, some of our care pathways that are going to be important. PT right now, I think we are kind of waiting for when we are about to step in. We know that we have a huge role to play in improving respiratory function and physical function after an illness. Many of our home care PTs are working with post-hospital discharge all the time. I think we're going to see a huge surge in the need for home care. You're welcome. I'm glad that you guys found that informative. We're going to have a huge need for home care, and that is where I think that I'm going to be called in by the College of Physiotherapists of Ontario, is in that home care setting to try and get people out of the hospital once they are out of precautions, and get them as strong as possible so that they can stay independent in their homes, so that we don't have this huge surge in need for long-term care or nursing home care. And so if you guys, again, have any questions about that, this is a developing situation. I encourage you guys to comment below, and I will post the link to the guideline. Again, it's in our Hump Day Hustling, so if you haven't signed on to that, I encourage you guys to do so. But I will also post the link to the guideline underneath this podcast. All right, guys, I hope you found that helpful. Have a great rest of your week. I hope that if you guys are in acute care that you are staying safe. If you have loved ones, that you are staying safe. If you are not, I hope that you guys are practicing all those physical distancing measures, because they're going to be extremely important to try and reduce the burden on our acute care PTs and on our healthcare system. So I hope you guys have been finding things to do, getting outside if possible, depending on what the mandate is in your state or province. All right, guys, stay safe, and I will see you. Actually, I think on Friday, I'm on the Fitness Athlete Friday podcast. All right, see you then. Bye.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.